Hi, everyone. My name is Matthew Solomon, and I'm the Director of Marketing at WPS. I want to thank you all for attending the third part in the three-part series, Sustaining Your Resilience in Stressful Times. Today, we're going to talk about tenacity and the 7 instincts that make us human. I'd like to thank you for taking time out of your day today, and we're happy to have Dr. Sam Goldstein here again with us to finish out the three-part series. Dr. Goldstein is the author and co-author of over 54 trade and science books, including the Encyclopedia of Child Development and Handbook of Resilience in Children. He's the co-author of 7 neurological and psychological tests, including the RISE, that's published by WPS, the Risk Inventory and Strengths Evaluation. In addition, he's the editor-in-chief of the Journal of Attention Disorders and Clinical Faculty at the University of Utah School of Medicine, serving as the Director of Neurology at the Learning and Behavior Center. I want to let you know that for over 75 years, WPS has been the leading independent publisher of educational psychological assessments and related intervention resources in the areas of autism, speech and language, school and clinical psychology, and occupational therapy. With that, I would like to introduce Dr. Sam Goldstein and let him take it away. Thanks, Sam.
Thanks, Matt. I'm hoping everybody can hear me okay. And this is an interesting time that we live in. When we started this first of this three-part series, we were dealing with a pandemic, and now we're dealing with a pandemic, and it's hard to know exactly what we're dealing with other than people are stressed and overwhelmed. In times like this, everyone gives advice. I'm not going to give a lot of advice today. I'm going to try and get you to think a little bit differently about who we are, what we do, why we do it, and maybe begin to conceptualize a different framework for how we educate children, how we prepare them to be stress hardy, even how we manage our own lives. I will tell you the topic I'm going to discuss today is a topic that Bob Burks and I have been working on for the past year. We're completing a trade book about this, as well as a textbook. And Bob and I have worked together. He's a dear friend and colleague. You can see on the slide there for 30 years. On the left are trade books we've written. On the right are textbooks, a documentary that we won a number of awards for a number of years ago, a radio series, and we've had the good fortune of writing print and other media articles, as well as presenting together. So the ideas I'm going to share with you today are equally mine and Bob's, but I'm going to be the one to be responsible for getting you to think a little bit differently and to shift your mindset. Looks like I didn't turn my mail off, so I am going to go into my mail and shut it off so that we don't get more mail coming across the screen. There we go. Okay, let me get you to think a little bit. Did you ever wonder how children learn to speak? Why do we speak? There is obviously some instinctual drive to communicate. Babies will babble, absent any model per se, but we won't speak unless someone speaks to us. So the genes can't operate without a push from the environment. How do children learn to manage their emotions? I joke sometimes with the children that I see that we're all born as Klingons, if you know the Star Trek analogy. And we all start out driven by emotion. Most 2- and 3-year-olds look like they have bipolar disorder because they're so driven by their emotions. Of course, that's normal for that age. And as we mature, we develop the frontal lobe capacity to manage the middle of the brain emotions. And one of the things that we see happen is that the middle of the brain gets information about the world a few milliseconds before the front of the brain. And in those few milliseconds, to borrow a term that Dean Falk coined, brain dancing, in those few milliseconds, if we're not careful, we brain dance. And we allow our behavior and our actions to be driven purely by emotion as opposed to a rational evaluation of both the circumstances and the emotion. How do children learn to do this is the question. How do children acquire knowledge? And in a previous webinar. If you haven't watched the other two, they are posted on my website and on the WPS site. But we talked about the fact that children acquire knowledge by applying their abilities. And knowledge isn't something we're born with. Even language, socialization, these are all knowledge-based phenomena. If you're not given the opportunity to socialize, you might have all the genes to do it, but you probably will not be able to socialize successfully without a model. So how do children do it? They use their abilities, which are unevenly distributed across the population. Some children have better reasoning capacity. Some children have better memory. Again, knowledge, vocabulary, comprehension, general information, that is something you acquire. And that kind of information should never be used to evaluate a child's intellect or critical thinking or reasoning abilities, because that kind of knowledge is very dependent on experience, and children that come from underprivileged circumstances or fail to have opportunities to acquire that knowledge may look not very intelligent, if that's the metric that's used. How do children master challenging activities? Believe it or not, that is me on a bicycle about 60 or so years ago. Um, you know, I'm very proud. I got that big bicycle I could barely ride because my mother thought it would be prudent to get one big bicycle, then a smaller one, and have me grade up to a bigger one. So she got me the bigger one. I had the biggest bicycle, but I could barely pedal it. But I kept at it until I accomplished it. How do children learn to do that? What drives that? How do children learn to socialize? How do they learn to create an identity? Who are they? And how are they distinct from others? And what I want to expand your thinking today about and shift your mindset is that how they do all these things is guided by a nexus of our genes and our experiences. And if you look at the identical twin studies, I believe I spoke about that in one of the previous webinars. If you look at the identical twin studies, twins who in the 1930s and 40s and even 50s were separated at birth and reared apart when they were put up for adoption. These identical twins who've never met, who finally meet as adults, it's a little scary, the similarities in their personality and their behavior and their likes and dislikes, even in their jobs and the people they call friends or the spouses that they marry. We think 80 to 90% of who we are is in the genes. So that leaves 10%. 10% doesn't sound like a lot, but if I could influence 1% of the stock market, I wouldn't be here. And the 10% that we impact, and the term in genetics is multifinality, the same genes lead to different outcomes over time based on experience, that 10% makes 100% difference in the course and the childhood and the adult life of any person. Just yesterday, I was meeting with a family whose child struggles terribly with academics and emotional regulation. And these parents recognized early on the differences in their child, and they've worked very diligently to manage those problems and to help the child develop without creating a sense of frustration or anger or low self-esteem in the child. How we respond has a dramatic influence on how the genes project. So maybe 90% of who we are is in our genes, whether you like it or not. 10% is influenced by the adults in our lives and how those genes express themselves. But again, that 10%, I believe, influences 100% in the course of our lives. How do children do it? Among the instincts we'll talk about today, and I want to explain what I mean by instinct and how that differs perhaps from what you might be thinking of when you think of the instinct of a salmon to swim upstream, or the instinct of a bird to build a nest when they've never seen another bird build a nest. But among the things we find in children is they're intuitively optimistic. They believe they can do anything: cook, clean, drive the car. When they're 3 and 4 years old, we think it's cute. When they're 12 years old, we think they're not necessarily being realistic. And the second part of that is intrinsically motivated. Rarely do 2 or 3-year-olds ask for anything in exchange for helping. They love the joy of being part of the group and helping out. As kids get older in our society, they are looking for the quid pro quo. And I think in part because of their experiences. I don't believe they're punished by reward per se, but I do believe that the more struggles kids have, the more we resort to extrinsic consequences. And if you look at those of you that are school psychologists, the children you work with in educational settings who are struggling the greatest tend to have the largest and most complicated extrinsic reward system, a level system or a point system or charts. And I think to an extent, extrinsic motivation has some role. And in our book, we've been looking at, and we have looked at, the research on how children who are intrinsically motivated can very easily be disenfranchised, and how easy it is to extinguish the intrinsic motivation that comes with engaging in a task and experiencing success. So kids do it through this instinctual or intrinsic motivation and optimism, and they solve problems through what J.P. Doss and Jack Naglieri, and before them Dr. Kirby, and before them A.R. Luria, talk about as simultaneous thinking or simultaneous intelligence. And I want to just shift your mindset today about simultaneous intelligence. We'll come back to that. They do it by forming relationships through compassionate empathy and genuine altruism and virtuous responsibility. These are in our genes. I am convinced that these 7 instincts, and we've looked at a lot and we've picked these 7, that these 7 instincts, long before we had organized institutions, schools, religion, long before we had the written word, that for thousands and thousands of generations, the evolution of these instincts, and evolution is a change for the better, the evolution of these instincts helped an older generation prepare a younger generation for whatever their adult life may hold. And they do it through measured fairness. Fairness is such a big deal. Why do we care so much about fairness? And it's fine if we think we're in favor or being favored, then it's fair. But why do kids complain so much about things not being fair? And should we respond to them, you're right, it's not fair? Or should we help them appreciate and understand really what being fair and experiencing fairness is all about? Dan Siegel, in his book, The Developing Mind, wrote that caregivers are the architects of the way in which experience influences genetics. And this is the idea of multifinality. I use Tiger Woods as an example. It is my firm belief that had his father not been interested in golf and not pushed him from an early age, he might have taken up golf at some point, but I don't think he would have been the athlete that he has become. So the age-old debate of nature versus nature, I think it's a moving continuum in which, in the end, as Emmy Werner has written, nurture trumps nature for all but the most extreme circumstances. Parents play a critical role. There's me and my dad a long time ago, and this picture has come to mean a lot to me. My parents married after World War II. They were a little older. I was an only child in New York City, where there were a lot of only children. I was the first mini-me long before they thought of it in the movie. There I am, proud as can be, dressed like my dad, absent the hat and the bow tie, but there I am. And the connections that we form as children with what Bob and I have referred to as a charismatic adult, an adult that you know is there for you in their heart or mind, no matter what, appears to be a critical foundation in shaping our development, and even shaping how these instincts will develop over time. And we have long advocated that when children transition into adult life, what's wrong with them matters little. That we care not about what you can't do, but about what you can do. And in our work together over the past 30 years, we focused on creating at least a balance, if not a tipping the scale in favor of understanding strengths and assets versus trying to fix liabilities. And when I shifted, I was a brain researcher 45 years ago, and I decided I liked children better than rats. When I made that shift, I was fortunate to have professors who helped me appreciate and understand that all children share qualities with every child, and that all children have qualities that are unique to them, and that all children share qualities with children who have assets, they do things well, or liabilities, they struggle. And in my training, I was trained that you don't fix what's wrong, you manage it. And for everything that's wrong, you better find twice as much that's right. And as people transition into adult life, the research on resilience has well demonstrated that in the end, assets provide a better appreciation and a better foundation of why some children with ADHD do well as adults and some do not. It is not solely about treatment, psychiatric, educational, therapeutic. It is not solely about experience. It is as much, if not more so, about assets. And children who struggle require the very same opportunities as children who are what we sometimes refer to as neurotypical. They require just the same in terms of opportunities to build strengths and to develop these instincts, but the challenges and adversities they face significantly limits their opportunity, the opportunities they have to develop a positive sense of who they are. And in our work, Bob and I have focused on this idea of resilience. How do you help children at risk continue to function well? And in the last webinar, I spent some time defining resilience, which from our view is not about recovery. It's about continuing to function in the face of adversity, and when the adversity passes, continuing to function well or even better. And again, I think success in childhood comes from harnessing assets and strengths, not just fixing liabilities. When I first started a long time ago, if a child had a challenge, say ADHD, then we called it hyperactivity, or depression or anxiety, we put the label after the child. We said the child with depression or with anxiety. And now we talk about the anxious child. We have shifted, the pendulum has swung to, I think, wrongly lead us to believe that if we identify and fix what's wrong with children, then we've evened the playing field. And what we're seeing, and I talked about this in the first webinar, we're seeing, as in lemmings falling over the edge, for example, the rate of major depression in adolescents in the last 6 or 7 generations keeps increasing. That trying to fix what's wrong, I think, like throwing starfish back in the ocean, is failing. That we need a different model in how we prepare children for adulthood, and how we conceptualize that process, in how we educate them, how we socialize them, and the opportunities we provide for them. So for thousands of generations, parents and family groups raised and prepared children to become successful adults. They didn't have any classes. They didn't read any books. How did they do it? And they certainly did it. In other words, our children are born completely helpless. And even in the time of that somewhat campy picture that I've added to the slide here, which theoretically is maybe 10 or 15,000 years ago, and I can tell you it's probably not politically correct, or maybe even correct in its structure. But how did they do it? How did they go about educating their children, passing along the knowledge of how to survive, because their children couldn't do it on their own. Children are incapable of doing that, at least until they're 10 years of age in our society. And until recent times, again, there were no schools, no organized institutions, no self-help or parenting books. And so I think it behooves us to go back and understand, how did they do it then? And what have we forgotten because we think we're smarter, and we think we have schools and other institutions, and we've increasingly farmed preparing children out for adult life to those institutions in the community. And I think our ancestors did it over tens of thousands of years by drawing upon and reinforcing 7 instincts. And we can see these instincts in other species, but in our species, I think these instincts have evolved and developed in a different way than in other species. So what are instincts? I think they serve a critical role in shaping the developmental course from child to adulthood, whether we're talking about birds or other animals, or even in our species. If we just talk about children, I think there were thousands of generations in which there were mutations, some of which were adaptive and enhanced how these instincts unfolded and the strength of these instincts in our children. And again, some increased the likelihood babies would survive and thrive and transition into adult life. And we chose the word tenacity. We'll define it as an umbrella, as an overarching umbrella, because we think the word and its meaning fits the application of these 7 instincts. And I'll explain that in a minute. We do consider the most important of these to be intuitive optimism, the unspoken belief that if you just keep at it, you will be successful. And we know that young children tend to be intuitively optimistic. They think they can do all kinds of things, even though they don't have the skill or the ability or the maturity to do it. But they believe if they just keep at it, their chances will be successful. Those of you that work with children in counseling or other mental health settings see differences in their level of intuitive optimism. Intuitive meaning, and I'm going to go through it a little bit more in a minute, but just sort of a knowledge, a belief that if I stick with it, I will be successful. And some children come to us perhaps shaped by their experiences, but also shaped by perhaps weaker intuitive optimism to start with, believing that they can't do anything and that they're not good at things, and they'd rather not try than try again and fail. And we would argue that, again, success in reaching developmental milestones requires continued effort despite failure. I was a pretty good skier, and now I play golf, but I was a pretty good skier here in Salt Lake City. Skied with my kids, and one day I decided to take up snowboarding, and I got on the mountain and I fell down 4 or 5 times and I took the snowboard back. That is, my intuitive optimism for snowboarding wasn't very strong. But we watch children learning to walk, learning to talk, acquiring knowledge. I'm not arguing that they have a conscious optimistic thought that they'll succeed, but that they have an intuitive optimism that if they stick with it, they will succeed. And we think this instinct is a vital component of self-discipline and a resilient mindset. And our work here really brings a culmination of our work over 30 years together. And we think this triad of a self-discipline, which we've written about and lectured about, and a resilient mindset, which is how Bob and I started our work, and now the idea of tenacity, that this triad really is responsible for the success of our species, and the fact that we're still here and other hominid species, including the Cro-Magnon, are no longer here. And we will argue that these 3 qualities, self-discipline, resilience, and the instincts of tenacity, are essential for us as a species moving forward. It will be interesting to conduct research on children of different ages in the coming couple of years in an effort to try and appreciate their mindset about the pandemic. I told a story last time about how one of the kids' thoughts were shaped by his parents' responses. It'll be interesting to see how their resilience has been impacted by this. I think our children, the term I use, is that they're hardwired to learn. They are wired up to acquire knowledge. Between 18 months and 3 years of life, the brain has 150% of metabolism. Children in the span of a year and a half go from not speaking to telling you how to live your life. And if they're in a bilingual home, they do it simultaneously in 2 languages, believing that everything they're learning has 2 words. So I think kids come ready to go if we're smart enough to help instill and develop these instincts. And so what we're arguing is that our job as parents is not necessarily to teach empathy, but to model empathy and offer children the opportunity to experience it and develop it themselves. That it is our job to create environments in which these instincts can be nurtured and can develop. And I think every society places expectations upon kids to acquire certain levels of knowledge and behavior. Kids today have to learn far more than I learned when I was in school. And there is a shift, I would hope, away from simply acquiring knowledge to teaching critical thinking and teaching kids how to think about knowledge and not necessarily to collect a large reservoir of knowledge. And I think children have to harness their instincts to acquire knowledge, to develop self-discipline, and to persist even in the face of failure. And so Bob and I think that these 7 instincts provide a critical foundation, regardless of culture, regardless of society, that this is universal among our species. And again, to make this distinction between instincts that we're discussing here, more complex kinds of behaviors, and simpler instincts, in many species, instincts are fixed patterns of behavior. A bird building a nest for the first time when no one's shown it how to do that, or a salmon returning upriver to spawn. Very clearly, our children are not born with sufficient instincts to survive. We think instincts represent a way of thinking or acting that increases the chances of survival and success. And in looking at it this way, we appreciate that knowing what to do and doing what you know are not synonymous. That possessing the instinct from a biological basis is one thing, but being provided with opportunities over time, and for some children, slow is fast enough, opportunity over time to shape and develop that instinct to assist and manage behavior. And I think ultimately the success of any of us is dependent upon the opportunities and experiences we have. And I will argue that these instincts are more important than ever in preparing children for tomorrow's successes. And I will argue that in the next 50 years, we need to shift how we see our role as parents. So here are the 7 instincts, and I'm going to define each of them, maybe give you some examples, and at the end, maybe talk a little bit about stress hardiness, just as a way of wrapping up this presentation. We hope that our book will be available by early or late winter this year or the beginning of 2021. And we are making an effort for every of these instincts to provide parents with ideas and guideposts. What do you do? What do we mean by doing this? If we define tenacity for a moment, it's perseverance, doggedness, resolution, patience, endurance, stamina. There isn't a universal definition. What we're arguing is that these instincts provide the push, and resilience and self-discipline provides the experience over time, as it were. That the instincts provide the fuel, and self-discipline and resilience provide the means, the engine, as it were, to drive these instincts. And so there's how I conceptualize it. It's a mental and emotional fuel that drives the other 2. Again, this is fairly theoretical and hypothetical as we put this together. But in our trade book and in our textbook, we have more than sufficient research to support that these instincts are what we say they are, and do operate in our children and in our species the way we say they operate. So here are the 7 instincts, and I want to take you through, let me go back here, and take you through each of them. Intrinsic motivation, again, being motivated from the inside out as opposed to from the outside in. Intuitive optimism, sort of this idea of knowing without knowing that if you stick with it, you'll be successful. I'll define simultaneous intelligence in a minute. Compassionate empathy, and we've made a distinction between empathy is appreciating what someone feels or thinks. Compassion is takes it one step further, being able to lend yourself based upon that view to help others. Responsibility, which we've coined virtuous responsibility. Altruism, genuine altruism, meaning altruism simply for the sake of being altruistic, not because there's any secondary gain. And in our world today, often altruism it masquerades sometimes when there clearly is secondary gain. And fairness, which we've talked about briefly. So this is how I see instinctual optimism, a belief. Starts with the genes, a belief there's always a way to be found, a belief that success will be obtained. I often ask kids when we're setting goals in counseling, how strongly do you believe this is going to happen? Do you think there's most likely will happen, it rarely will happen? When I talk to kids about their sense of mastery, I'll ask questions like, if you continue to succeed or continue to work at success, how often are you successful? And some kids, I had a child in my office earlier the week, said, I don't keep trying because I don't succeed. And I don't think any child is born absent these instincts. I think they may be stronger for some, weaker for others, but I don't think anyone is born absent them. It's this belief that if you persist, success will be obtained. The idea of seeing the glass as half full rather than half empty. And I do think that you can provide experiences to children and adolescents and even to adults that can nurture and harness that instinctual optimism. Think about young children going off to school. We think they can't wait to go to school. Let's partial out those who are anxious. We think they're happy to go to school because a sibling is going, or because they have new shoes or a new shirt. The reality is they're instinctually optimistic. They believe that whatever you put in front of them, they'll be successful at. And when they get to school, for some of them, and they struggle, then the world changes. And that when that optimism is extinguished, my experience has been it's very hard to educate children, which I think is why so many kids in special education struggle. And I think it's very difficult in counseling or therapy to make change if the child doesn't believe that keeping going will lead to success. It's again driven by internal reason, by inspiration. It's rewarded by the payoff to the mind. It's rewarded by the success, not by anything you dole out. It's guided often by belief, not necessarily by environmental consequences. And then simultaneous intelligence, which I want to spend a minute on here. So let me give you two examples that I use with parents. And I don't use the word intelligence much anymore, because for 2,000 years, intelligence was defined as how well you could solve problems. There were no schools. There was no organized educational system. There were maybe apprenticeships. And I think in some ways in the last 100 years or so, our educational system has co-opted the idea of intelligence and giftedness. And one has to be advanced in knowledge as well as thinking in order to be in gifted programs. I have some children I work with who sometimes the term used is twice exceptional. They're gifted intellectually, but they have reading disability. And the school districts I deal with in Utah will not put them in gifted programming, which I think is incorrect. The term I use is simultaneous or simultaneous intelligence. It may also be synonymous with critical thinking, with the term critical thinking. The term was first coined simultaneous by Luria, and it is seeing how all the parts fit together at the same time. And the examples that I use with parents, there are two that I like, and you're welcome to use them. I'll ask parents to tell me the next number in this sequence, 2, 4, 6, 8, 10. And parents will answer 12. It is a predictable sequence, not a whole lot of simultaneous thinking required. And then I'll say, tell me the next number. 1, 3, 6, 10, 15. 1, 3, 6, 10, 15. And some of you are saying to yourselves, 21, because you have simultaneously examined each digit in the sequence and developed an appreciation for the relationship of every digit to the next digit. That's simultaneous ability. The second example I use for parents is I say, if I gave you 10 facts about a particular animal and you picked 3, you might choose an animal that matches the 3, but might not match the remaining 7. Good simultaneous thinkers see all the parts of a problem together. Those of you that are school psychologists know we use matrices, for example, patterns, for example, on the tests that Jack Naglieri and J.P. Doss first developed that I've been privileged to participate as an author, the cognitive assessment system. We have a series of tasks that require children to think in simultaneous ways. And so simultaneous thinking is about a reading comprehension. It's about writing for meaning. It's about more complex math. A good rote memory doesn't help with simultaneous intelligence. I think this kind of thinking is something that our species can do that I don't believe other species can do particularly well, if at all. It's the ability to see how each part is related to the whole. And we see some children with good basic rote skills, adequate sequencing, adequate attention to detail, who acquire knowledge early on, label, sequence, association, retrieval, and they look fine. And then when they have to begin reading to learn or writing for meaning, they struggle. And I don't think you can change simultaneous intelligence. I think it is, I'm not a biological determinist, but I think there is a biology to it. But one can always learn strategies to function better. One can always learn strategies to write a better essay, to score higher on a test, an achievement test, or a high stakes test like the ACT. The strategies taught in ACT basically fall under the umbrella of simultaneous intelligence. Second is compassion and empathy. I don't know if I'm up to 2 or 3 here. I've lost count. I can't see my slides. But you know, we have different meanings for compassion and empathy. I apologize. The way, hold on a second here. My title on the left left out a hyphen, so it's not compassionate empathy. That's pretty funny. It is compassionate empathy. I'll fix that before the slides are posted. But we think there's a difference, and we think they're distinguished from each other, but deserve to be considered together. We think that empathy is understanding the world of another person on an affective and an emotional level. We think compassion is the capacity to draw upon that understanding to improve the lives of others. It's one thing to appreciate the pain that someone is suffering because of a loss, because of an adversity, but empathy alone doesn't lead to action. One has to have compassion as well. So we have put the two together and refer to them as compassionate empathy. And there are many examples that young children demonstrate both of these qualities at an early age instinctually. And if you give them opportunities to shape and develop it, you see more of it. And some children struggle, and even when given opportunities, have a difficult time with it. Think about, do you practice what you've learned and lived? Do you allow emotions to interfere with empathy? Do you make assumptions about the motives of others? Do you hold erroneous beliefs that if you're too empathic, people might take advantage of you? These are some of the questions we have parents and children ask of themselves in an effort to try and shape, develop, and develop empathy. And we have some exercises. We'll often ask children to write down a few words about how they think their parents would describe them, and a few words about how they would like to be described or how their parents would describe them. It's an activity we sometimes ask teachers to do in classrooms, to have children not write their names, but to write some words that they would use to describe the teacher. It takes a lot of bravery for a teacher to do that, to see what do students think about me, and then to use those experiences as a guide and to put empathy into practice. And then virtuous responsibility. It's behavior guided by dignity, morality, and a respect for self and others. When we see what's happening in the world right now in the US, we see a disturbing dichotomy. We see what I believe is the majority of our population who are attempting to advocate for change for the better in multiple areas, whether it's in police activities or discrimination or civil rights. And their activities are clearly guided by dignity and morality and a respect for others. And yet we see what I think are a smaller group, but a louder, more violent and aggressive group, and a group that gains the attention of the news media any night, any channel. The first thing they report is not the peaceful march. The first thing they report is anything violent or aggressive. And why that increases ratings maybe speaks to who we are as a species. We gravitate towards that. It's unclear sometimes why. But virtuous responsibility, I think, is something that's at a loss in some of our population, and some are so disenfranchised and disconnected for reasons that are unclear. And I do think that we brain dance, as I mentioned, and that it is difficult for us to maintain our dignity and our morality when we're angry or when we're threatened or when we are unhappy. And the last component of that is to maintain integrity. And genuine altruism, giving of yourself, sincerely helping others, not because there's any secondary gain in it for you. And children are born altruistic. One of my favorite studies of all time took place at the Max Planck Institute of Behavioral Genetics in Germany. And a researcher is interacting with a 4-year-old child at a table. The researcher drops their pen. The child, without being asked, leans over and picks up the pen and gives it back to the researcher. And in fact, the researcher sometimes repeated that action multiple times, and every time the child helped without being asked, and never complained and never criticized the researcher to be more careful. That research has been done with chimps. Chimps also will exhibit altruistic behavior, believe it or not. I joke that someday I'd like to do that research with canines, because I think their evolutionary history is different. And I think when you drop something, they're not going to do a whole lot. When you throw it, they'll go get it. And in that research, at one point, the researcher took the pen and threw it across the room, and the child didn't go after it. The child could understand the difference between a behavior that required assistance and a behavior that they didn't understand, but they didn't perceive required assistance. So I think altruism is defined, honesty is repeated twice there, and I apologize. And then finally, fairness, a concept that's developed in game theory, being fair to yourself first and then to others. How much do you give of yourself? If you give 100% of yourself to others, you won't survive. So there's a line to be drawn and knowing when you have to put yourself first. And the neurobiology of fairness is fascinating to look at what happens in the brain when we think something's unfair. If you're entertaining yourself on YouTube videos, take a look at the videos of the two monkeys, macaques, who are in two plexiglass cages. They can see each other. There's a hole in the front of each cage, and the monkey has to pick up a rock from inside the cage, hand it to the researcher, and the researcher, in exchange, the researcher gives them a grape. Macaques like grapes. And so they each do the rock and they get a grape. One monkey watches the other one. They do a rock again, they get a grape. But the third time, the one monkey gets a grape, the second monkey gets a piece of cucumber, which isn't as desirous. And the monkey looks at the cucumber, looks at the other monkey, eats the cucumber. Then again, the monkey gets the grape, the first monkey, and the second monkey gets cucumber. And this time, he looks at the cucumber and he throws it down on the floor, on the floor of the cage. And he steps on it, doesn't even eat it. So they do it again. And they give the grape to the first monkey when he gives a rock. This time the third monkey, still hoping for that grape, gives the rock. And this time he gets another piece of cucumber, but this time he screams and yells and runs around and takes the piece of cucumber and throws it back at the researcher, and then at some point throws some feces out back at the researcher as well. Fairness is a big deal for us, and it's unclear why. Maybe because it's helped us survive, maybe because it's in our culture and kids worry about being fair, and our favorite answer when they complain about it is, "You're right, life's not fair." I'm not sure how much that actually helps them. So I think the road to tenacity for us with our children, with us, with our students, is to examine our assumptions about why kids do what they do. Why, meaning, do we understand how these instincts shape their behavior? Do we understand how their temperament shapes their behavior? How a child with a very low emotional threshold and a high intensity of reaction may begin to experience the world and then may make choices that we think are poor, so we punish them with the erroneous assumption that that will change their behavior. I think we have to find ways to challenge self-defeating attributions to help kids develop islands of competence and pursue them. Our model of communication is to listen and learn. Sometimes people just want to be heard. Sometimes parents will come in and I just finished writing about this, a story of a parent who came in and just felt terribly anxious when her child came home and told her that she had no friends. And the parent immediately responded out of anxiety, "But you do have friends. I've seen you with other kids, and so is your friend." And the child just looked at the parent. This was a latency age child, and broke into tears and responded, "You never listened to me," and ran out of the room. We're very quick to be stressed and troubled by our children's adverse feelings and adverse ideas. And sometimes people just want to be heard. If you were a therapist and a client came to you and said they were depressed and you responded, "Well, you don't have any reason to be depressed, you seem just fine," they probably would not come back to see you again. So we want kids to learn from experience, but we want to do it in a way that builds up rather than tears down. We need to do it in a way in which we know when to act and when to step back. And I think we have to take a long-term view. Bob and I coined the term taking a helicopter view, not realizing that it was a term that was already used to describe parents who hover over their kids. And our use of the term is very different. By helicopter view, we mean getting up above and realizing that it's a long road to adulthood. And you'll have many opportunities to change and modify and shape behavior, and that the sense of desperation we sometimes feel as parents or educators really doesn't serve us or our children well. I think we should exercise resilience on a daily basis for ourselves. I think at the end of the day, as Covey described in his 7 habits, sharpening the saw. That was his 7th habit. I have to ask, have I really tried to listen? Have I really tried to understand the viewpoints of others? Have I practiced empathy and respect? Have I related to others? How have I responded to mistakes or stress? What have I learned? What will I do next time? I mean, with the children that I work with, we celebrate mistakes. We view mistakes as opportunities to learn rather than experiences to avoid. And to ask yourself, where did I do well? And how can I reproduce my positive behaviors tomorrow? And I think you can't wait for other people to change because you could wait forever. You have to do something different. And you'll find when you do something different, people over time will respond differently, even if you're right and they're wrong. Look, I'm a New Yorker, so most of the time I think I'm right. I don't know if it's an instinct that only New Yorkers have, um, but if I advocate for that, I alienate people. And so even if I think someone is not completely right, I will listen and offer empathy and try and help them appreciate my view of it. This is a research project that's 20 years old now. That was done at Tufts University by Lerner and colleagues. I call it the 5 C's. We use it in trying to develop functional classrooms, functional families, functional relationships, and I would urge you to consider it if you don't already know it. How do we build competence? What do we do to build competence in academic or social or vocational areas? How do we build confidence or a positive identity? How do we help kids develop healthy relations and connections? How do we shape character, positive values, integrity, and finally caring and compassion, all of which I think are rolled into these 7 instincts. And I encourage teachers when they do back to school night to use this as a model to help parents understand what they're trying to accomplish with their students, particularly in elementary school. Stress hardiness, I think it's committed to finding purpose in life, a belief that you can influence your surroundings and the outcome of events in your lives. I think that very clearly depression is a sense of hopelessness or helplessness, and eventually a belief that no matter what you do, you don't make a difference. And finally, a belief that you can learn and grow, not just from things always going well, but from negative life experiences as well. Dan Brown, I think I've used this quote before in these 3 talks, in a novel, wrote that we need to make certain that our philosophy keeps pace with our technology. And I don't think that's happened. I think these rapid changes in science and technology have so outpaced our capacity sometimes to cope that I worry about our future. And Brown wrote that, compassion should keep pace with our powers, which really is something good to think about in what's going on today. And that what we do should be based, he talks about love, but should be based on affirmation and not based on fear. I think a fear-based society is one that is eventually doomed to failure. I have just a couple of minutes left that I'm going to turn over to my colleagues at WPS. There's my website. I can tell you on my website, I have all kinds of articles. You're free to download them. You can subscribe to them. I won't try and sell you anything. I'll just send you articles as I post them. If you're an attorney and you know attorneys, I do quite a bit of forensic work. So I post research summaries on different areas of civil litigation, traumatic brain injury, and other kinds of civil litigation. And there are links to my webinars. There's my email. I answer all my email. If there are questions, you can submit them to Matt and Laura, and I will respond and they will post them. There's my Twitter and my Facebook that I try and not be too controversial on. And then there's a link to my TED Talk. I was fortunate in 2012, I think, or 2013, to do a TED Talk titled The Power of Resilience. People keep watching it, which I'm very pleased about. It talks about this clinic that we started here in Salt Lake City 40 years ago. We see about 500 kids a year. We see some adults as well. The kids we see, about half have brain injuries. The other half have complex genetic disorders. I tend to see kids who've seen multiple other providers and have been refractory to medication or psychotherapy or educational intervention. And I've come to learn that what's wrong with you gives me some idea of where you are, but what's right with you gives me a much better appreciation of where you might go in life if I'm smart enough to help you learn to be resilient, if I'm creative enough to help you develop self-discipline, even if you struggle, and if I understand these 7 instincts and how to shape and develop them in children. I think all of us can be successful with the children and students we work with, no matter how great their challenges. So I encourage you to watch that YouTube video. That's it for me. I appreciate the opportunity of doing these 3 presentations. As long as we're prevented from speaking in person, I will continue doing short presentations like this. I am hopeful that in the fall we will be able to do live presentations again. It's one of my great pleasures, traveling and meeting people and doing presentations about my tests or about concepts like these or about conditions that children have in school districts or medical centers or other institutions. So I look forward to seeing you all again. The world will get better. Time is our greatest resource. Time is our greatest healer. We just have to be patient and prudent and let time do its work. So I'll turn it back to Matt there. He may want to say something about the RISE or have me say something about the RISE and tell you a little more about WPS.
Hi, thanks, Sam. Yeah, I would love it if you talk a little bit about the RISE.
So the RISE is an instrument. It's the first instrument that combines strengths and risks in one tool. It allows you to evaluate sort of how the two relate to each other. David Herzberg, who is at WPS, and I developed it with guidance from Jack Naglieri, who's not an author. And it looks at 3 interpersonal strengths. When you factor analyze internal and interpersonal behavior, it always factors into 3 areas: a sense of emotional balance or emotional well-being, or a sense of relationships with others, and a sense of capability or mastery. The terms sometimes are used interchangeably. So we measure those based on what's normal in the population, so you get an idea of where a student or a child may be. The instrument starts at age 9, but goes all the way up, I believe, to 25, because we know the riskiest time in life is young adulthood. We're going to see more and more instruments progressing with normative data in that direction. And we measure 6 areas of risk, things like substance abuse or sleeping and eating or sexual activity. And the risk factors provide cut scores and allow you to understand whether a parent or a teacher or a self-report, for that matter, in terms of the items that are endorsed, crosses a threshold that is similar to the level of difficulty in that area a child or young adult had who ended up being in treatment for that problem. So it doesn't give you a score, but rather a cut point, letting you know that this parent's observation or this self-report is consistent, for example, for a youth who ended up in treatment for that kind of a problem.
Excellent. Thank you so much, Sam. I'd like to go to the next slide to let you know that we have valuable resources that can help you in each of your states. We have someone that covers that as an assessment consultant. They'll be happy to answer any questions you might have specifically about assessments. And on the next slide is a list of other resources that we have that we will actually email out to you along with a link to the slides and all of the answers to your questions that will come directly from Sam. I just want to tell you how much we appreciate all of your support, Sam, and to all those people out there who came and took the time to listen to this. We really appreciate you. We hope that you enjoyed it, and we welcome any feedback you might have or any ideas you might have for upcoming webinars or videos you'd like to see from WPS and our authors. So thank you very much, and we hope you are all well.
Thanks, everybody. Bye-bye.